Hello everyone. I am Dr. Reshma Jhaveri, an ophthalmologist at SureSight Eye Care by AIM Multi Speciality in Juhu in Mumbai. So welcome to the BVI Conversations, which is the first ever of its kind. And here we are going to talk a lot about ophthalmology, the myths, the new trends that are in, and a lot of questions that a lot of us have in mind. On this show, we are going to get many different renowned ophthalmologists from across the country. And our first guest for today is going to be Dr. Sheetal Brar from Chandigarh. Dr. Sheetal Brar is the Chief Medical Director at ProSight Eye Hospital, Chandigarh. She has trained more than 200 trainees in phacoemulsification and complex cataract surgeries and more than 100 surgeons in refractive surgery. Participated in over 100 master classes and instructional courses and performed live surgeries of phacoemulsification and smile. 100 plus publications in national and international peer-reviewed index journals. She is the reviewer for Journal of Refractive Surgery. She is the first ophthalmologist from India to receive the prestigious ACE Award, that is APACRS Certified Educator.
Thank you, Dr. Reshma, for having me on this show. And it's entirely my privilege to be interviewed by such a ravishing, beautiful, and iconic ophthalmologist.
Yes, so welcome to the show, Dr. Sheetal.
Thank you.
Okay, tell me, what has been your journey in ophthalmology? I mean, what has inspired you to specialize in cataract and refractive surgery?
Well, I think I've had a exciting and remarkable journey in ophthalmology so far. And this journey indeed started 18 years ago when I just finished my MS, that is specialty in ophthalmology from Christian Medical College, Ludhiana. And I just joined senior residency in another medical college in Punjab. So back then, medical colleges did not really have all the cutting edge technologies and tools that we have these days. So cataract surgery was a basic surgery at that time. And many of my senior colleagues were also performing ECC and SICS in those times. And I was also one of them who had just started with SICS surgeries. And during that time itself, I started attending conferences. And my first ever conference was the All India Conference at Bangalore in 2011. And during that time, I saw many of our senior ophthalmologists, stalwarts of the Indian ophthalmology, speaking about and showcasing their surgical skills in live surgeries and also sharing their experiences with premium IOLs and how happy their patients were after cataract surgery, and they were able to read well for near and his multifocals and trifocals and the new stuff that was coming in during that time. And that opened an entire new world for me in ophthalmology. And I realized that I need to do better. I need to learn more. And this is what inspired me to take up ophthalmology fellowships. And really, I was very fortunate to get the opportunity to do long-term fellowship in two prestigious institutes. The first one was Arvind Eye Hospital from Madurai. I did my long-term cornea and external diseases fellowship from there. And after that, I went to Bangalore at Netradhama Super Specialty Eye Hospital, and I learned a good deal of clinical knowledge, surgical skills, research, and ample of opportunities at national and international platforms that actually made me what I am today. People know me as a researcher, as a surgeon, as a trainer. So because of all those opportunities, I think it has been a remarkable journey for me so far. And I'm very happy to have come this far in this journey.
Yeah, Sheetal. In fact, I have been watching your journey, I think, for the past 10 years, and it is outstanding. I think it's a
Thank you.
journey what everybody wishes to follow. From Bangalore, from, where you started, just learning to now you training so many people. and so many students who don't get to train otherwise, and you are there for them. I think it's outstanding. So tell
Thank
me
you.
more about your new place that you have started in Chandigarh, which is the ProSight Eye Care. Can you tell me a little more about it?
Yeah, so ProSight is a work in progress. It's going to be started very soon in another couple of weeks, and I'm super excited for this. This is my own venture, my baby. So, after spending 11 long years in Netradhama and having a glorious career, it was difficult for me to settle for a regular 9 to 5 job, right? Because I did a variety of work and I was wearing many hats. And so I was used to working in that style.
Yes.
So I wanted to do surgeries, I wanted to do OPD, I wanted to travel to conferences, I wanted to train people, I wanted to also do clinical research. So ProSight is going to have everything. So I'm going to offer the cutting edge technologies to my patients, femto laser cataract surgery, Smile Pro, which is the latest laser refractive procedure for spectacle removal, and many other exciting technologies and innovative IOL technologies as well for the benefit of my patients.
That's amazing. I can totally imagine, like, where you are in a institute where everything is just walking to you, and
Yeah.
now to move out of that comfort zone and starting your own practice. It's difficult, but I think that's adventurous, and I know you are that person.
Certainly.
So definitely, this is going to really take you a long way. So
Thank
you've been
you.
talking about this Pro Cut lasers, the Smile, and we have different modalities for refractive surgeries.
Yeah.
What do you think is the difference among these different modalities, and why did you choose the laser that you are going to offer to your patients?
So, of course, I'll be offering Smile Pro, which is the latest in refractive surgery. But I'll also have access to LASIK and PRK, which have been pretty much around and preferred choices for refractive surgeons so far. With Smile Pro, I believe it's a very convenient and a very hassle free and comfortable procedure, both for the surgeon as well as for the patient. The lenticule creation happens in under 10 seconds. So that's the time during which the patient is super anxious. When they have to hold their gaze to the green light and they cannot move and cannot talk. And that critical time is reduced to just 8 seconds, so which is super fast. And
Yes.
energy is very good. And dissection wise, I've used this system earlier also, and the results are fantastic. From the patient's perspective, it's a comfortable procedure, practically painless. They don't feel much
Any
pain
pain?
or discomfort, and the recovery is quite fast, and the post-operative restrictions are minimum, which means after 2 or 3 days itself, they can go back to all of their normal activities such as washing face, head bath, even eye makeup,
Yeah.
and going to gym, exercise, vacation, whatever they want to do, they can do. So they don't feel restricted after the surgery, which was an important challenge after LASIK or PRK, wherein the patient had to observe restrictions for a much longer time,
Right.
at least 2 to 3 weeks.
So, Sheetal, a lot of these patients come to us that we want to get rid of our glasses. I think that is what refractive procedure is all about. But can you give a little more in detail about how we do these procedures?
Sure. So, refractive procedures can be done for both cosmetic as well as functional purposes.
Yes.
So, there are many patients who wear glasses and they don't have problem wearing glasses, but they want refractive correction because they are dependent on glasses. They cannot function. I mean, look at those patients who have high myopia. -4, -5, -6, and above. Some of them have more than -20 also. I've seen those are the patients for whom we do ICLs. And for some, the reasons are cosmetic. Even if they have like a zero 0.5 or 0.75 power, which is negligible, they would still want to get rid of the power. Now, how we do refractive surgery exactly is, this is just for the knowledge of the viewers, is we reshape the cornea. Cornea is this round black part of the eye which is reshaped in such a way using highly precise and special lasers. They reshape the cornea in such a way that the image
Wow.
directly falls on the retina, is formed on the retina. So when you have power, the image forms either in front of the retina, which is in myopia, or behind the retina, which is in hyperopia or farsightedness. So using these special lasers, we can reshape the cornea and make the image form on the retina so that the person is able to see without the glasses or contact lenses.
That's so true. There are some myths that are there against these laser surgeries, the LASIK or smile surgeries. And one of the most common myth that especially patients who come to me that doctor, after LASIK, is it that we would develop a cataract for sure? Do you get such patients and how do you deal with such myths?
So I just tell them that, see, nothing is permanent in life.
Yes.
Even we are temporary and our bodies are also changing. And refractive surgery is not like cutting a wood or glass or steel that your cornea would remain the same forever, right? As we are aging, our corneas will also change. And also, all the changes that would come in our body with aging are inevitable, such as cataract. So you asked me about cataract, right? So definitely, when you enter the cataractous age group, which is anywhere from 55 to, let's say, after that, so you are expected to get cataract.
And also there are other different issues like, digital eye strain. And if patients develop any systemic diseases, I think that also can lead to change in the power. So
Certainly, yeah.
definitely it's not permanent.
Pregnancy,
Pregnancy,
hormonal
absolutely.
changes,
Yes.
and also patients on hormonal medications like the PCOD patients. Female patients, I'm little
Yeah.
more concerned, and I like
Yes.
to counsel them accordingly. That see, these are the phases of life, especially pregnancy and hormonal changes. That there can be slight changes in the power, and we have to accept it. However, the change that we have done on your cornea is pretty permanent. It's not that your cornea becomes the same again. So there will be some amount of flattening and this will stay. However, over time, there can be minor changes for which you may either opt for glasses if you want, or many times we are able to even do a retreatment and enhance it.
So there's one more question that a lot of patients ask is if the patient develops cataract later, is that possible post a LASIK surgery?
Yes, so they can get cataract anytime after the age of 50 or 60, or it also depends upon not only on the age, but also if they have any associated medical conditions such as diabetes. So we know that diabetes have the chance of getting cataract earlier compared to the normal population.
Correct. So, what advancement in cataract surgery have you seen in the past couple of years? You've been now practicing for such a long time now. So, from where it started, as you had mentioned in the beginning, that how there was ECC and SICS,
Yeah,
and now it's shifted to phaco and then femto, and then lots more coming up.
yeah.
That is one entire change. Also, the change is about the lenses. So,
Yeah.
can you give us little brief about the advancements that are happening in cataract surgery?
Yeah, so from where I started, I think the entire landscape has changed. I was doing SICS, ECCs, and now I'm doing femtocataract surgeries. So I've seen, at least in the past 10 years or 11 years of my career, when I went to South and Netradhama, a number of exciting technologies coming in, newer lenses, newer phaco machines. What I find is very remarkable and completely game changing is the advent of femtolaser cataract surgery. I mean, could you even think few years ago that you will have a robo wherein you just enter some values and it's going to do most of the steps of your cataract surgery? I mean, isn't it amazing?
Crazy.
Right? Yeah. So that's one thing which is very exciting for me. And of course, our IOL calculation formulae have improved so much, right? And so many new lenses have now been introduced that can give our patients almost 100% glass-free vision after surgery. The wonderful trifocal lenses, EDOF lenses, enhanced monofocal lenses. these are really exciting times in which we are living, and I think there's so much more to come in this space.
So Sheetal, this is, you've just mentioned that you have started your own center now, which is ProSight Eye Center in Chandigarh. What do you think you face the difficulties?
Well, fortunately, in my case, I did not face any major difficulty because I got the support of three of my colleagues who are well known practitioners in Punjab. And it just happened so that they wanted to come up with a center in Chandigarh, and I also wanted to start my practice in Chandigarh. So we teamed up, and we are investing together, and it's our joint venture. But I will be the director and the face of the practice.
Because you already have such a great name in the ophthalmic industry. I think it is you've been in a very good position when you start your own clinic. But still, there are some decisions as a director that you need to make for yourself and for your center, like which phaco machine to use or which technology to use. So, how do you go about doing this?
So, of course, having used a number of technologies and having experienced with different types of machines and various technologies, so I had a fair idea what technologies I want to bring in my practice. And again, as I said, my partners are very supportive, and they agreed with my suggestions as to which machine I'm going to use and which technology I'm going to bring in my practice. So the phaco machine I will be using in my practice is the Revo Smart from BVI. It's an exciting technology and a beautiful masterpiece. I have used it for some of my patients when they sent the machine for trial, and I was completely amazed to see its performance. It's based on active fluidics, and this principle is available in very high end machines. And this machine does have active fluidics, and the chamber stability is excellent. The followability is great. And you have everything that you want to see in a phaco machine, in a dream phaco machine, I would say, as a phaco surgeon.
It's like getting a good ornament. So,
Yeah.
Sheetal, you won't believe Diwali has just gone, and all my friends were discussing the women friends, that
Yeah.
oh, I bought this ornament and this diamond set, and I'm thinking which best machine will I buy, because that is something that we look into as
Certainly.
way to a best investment,
Yeah.
right?
As a cataract surgeon, you need a machine which is
Yeah,
safe,
which is
which is
safe, correct.
efficient, which is also a bit economical,
Yes,
and
absolutely.
it
And that
has
we
all the
can,
great
yes,
features.
and that we can offer the best to our patients in that. So
Certainly.
this definitely would be one of your best choices, I guess.
Yes, and I'm very proud to have this ornament in my armamentarium.
Exactly. So coming to the lenses now, what do you think is the new technology that you think you would want to offer? So as I said, there's an array of lenses available in the market
Yeah.
nowadays. So we have a whole list. It's like a menu card. Is you go to a restaurant, you have a whole menu. We have really a whole menu of different lenses.
Yeah.
So how would you decide that you want to offer this lens to the patient?
So earlier we used to have only monofocal lenses, so we didn't have much choice. Now we have different lenses, different variety of lenses like enhanced monofocals, EDOF lenses, multifocals, trifocals. So, and the list is getting bigger and bigger. So I think it's very important to look at what your patient needs, what is the personality of the patient, what are the predominant type of activities they are doing. And nowadays, most of our elderly cataract patients are also quite active.
Yes.
They want to live life without the hindrance of glasses, and they want to do outdoor activities, they want to go trekking, hiking. They use mobiles, laptops, tablets for online transactions, surfing social media, and I've seen many of them are also, models and using social media quite a lot. And they're TikTokers and YouTubers and all. So for these patients, I've seen this trend is changing now. Most of these patients now are asking for a lens that gives them complete
Absolutely.
spectacle independence, or at least reduce their dependence on glasses for most of the activities. So, looking at their requirement and their day to day activities and what kind of lifestyle they are living, I decide about the lens. And of course, also you need to look at the eye condition. I mean, if they have any retinal pathologies, ARMD, any retinal hole, unfortunately, they are not very suitable for trifocals and multifocals, but still, the new enhanced monofocal lenses like the ISOPure from BVI is a great choice for these patients with macular pathologies or some other pathologies wherein a trifocal lens may not be a perfect choice for them.
So इतने सारे lenses available है market में शीतल. When you were talking, how come आपको BVI lenses में मतलब क्या अलग सा दिखा जो दूसरे lenses में नहीं है?
Yeah, so what fascinates me most about BVI lenses is their unique design. So their design is double C loop or pod design. So ये एक special design है that gives 4-point fixation to the lens, which is considered to be a very stable positioning of the lens in the capsular bag. So the changes in refraction that normally happen over time after cataract surgery, when it heals, after 1 year, 2 years, you will see that the patient is either myopic or hyperopic, the lens changes its position. So those kind of things are not expected with these lenses because they remain extremely stable in the bag. So because of this reason, their toric lenses are also very stable. And that has given me the confidence of using a toric lens for even a small cylinder as small as zero 0.5 diopters.
Wow, that's amazing.
So yeah, that's because the lenses don't rotate. They're
So they are
extremely
definitely the
stable.
lenses of the future.
Certainly.
Amazing. So let's move out of this and talk a little bit about what are the, some funny myths that you've come across as far as cataracts are concerned. Like in Mumbai, patients come to us and say, especially when we, ask them that you have a cataract, you should go ahead with the surgery. नहीं नहीं अभी तक पका कहाँ है? As
Yeah.
if it's a mango
Oh,
and it
that's a
needs to
very
be,
common myth.
that's one of the most
Yeah.
common myths. And we are like, now we don't wait for it to ripen,
Certainly.
earlier
Yeah.
the better. So
Yeah.
any of such ones that you have faced in your practice?
So I think our patients have a lot of myths around cataract surgery, and especially since I've moved back to North India now, I come across really funny and interesting myths actually. One of them being that कि cataract surgery के बाद बहुत कमजोरी आ जाती है, and patients come back to me and then they're like, oh, we are bedridden and हम बहुत rest कर रहे हैं क्योंकि हमें बहुत कमजोरी feel हो रही है, and doctor, can you prescribe us some multivitamins? And I tell them, see, your cataract surgery was just 5 to 6 minutes. We did not give you any
Anything.
injection.
Yeah.
There was no loss of blood at all. And you walked away like normally as you came inside, right? So there was, I mean, it was a comfortable procedure for you to get done. And uh, there's no chance that you will get any kind of weakness. It's not a very major surgery. That's one thing. And there's another thing that हमें डॉक्टर साहब सर्दियों में ही ऑपरेशन करवाना है एंड वी डोंट वांट ऑपरेशन इन समर्स सो दिस सीजनल प्रेफरेंस इज समथिंग अगेन आई सी very strong in North India.
But at least you are lucky you're in Chandigarh, you have winter. In Mumbai also they want in winter, which is like typically for 3 days now. So,
And I tell them that,
yes.
see, whether it's summer or winters, you have to take care of your eye. If in winters also, say, if you're rubbing your eyes and putting water and are not following precautions properly, you can get infections even in
Absolutely.
winters. So there's no particular season for to get cataract surgery done.
Okay, that has been really nice. Now, I just want to know a little bit more about you, Sheetal. We've spoken about cataract and phaco machines and a lot of it, but as a person, so this is going to be like a quick rapid fire.
Oh.
All right. And without even thinking, I want you to answer those questions. Okay. So, quick one. For you, Sheetal, is it masala tea or green tea?
Green tea always.
Cold, rain, or summer?
Neither of these, but I like cold and winter season, but not raining.
Okay. Describe yourself in one word.
One word. That's tricky. I don't think so. I can use just
Gorgeous.
one word to, or few words maybe.
I can put it for you.
That's nice of you. But if you allow me to use 2 or 3 words, maybe.
Please go ahead.
So I'm a Sagittarius, and I embody all the qualities that a Sagittarius has. So I'm ambitious, I'm optimistic, adventurous, and somebody who likes to take challenges in life.
Excellent. Next question is your favorite childhood game?
Badminton,
Oh, nice. And your hidden talent?
bathroom singing.
Oh, wow. So, this is a good one. If you could rename cornea, what is other name that you would choose for cornea? Since you are a cornea refractive surgeon.
That's an interesting one. How about calling it as a winking window?
Okay, that's nice. Thank you so much. And we've really had a wonderful time chatting here with you, Sheetal.
Same here, Reshma.
So much to learn from you.
Likewise, Reshma, it was my first podcast ever, and I did not know I would enjoy it so much.
Yeah.
The entire team was so supportive, and especially you as such an amazing host. And I share that comfort zone with you, being my friend and colleague. So, thank you so much for having me here, and look forward to such more engaging and interesting conversations in future as well.
Thank you so much for being with us today. So, this is our first ever episode of BVI Eye Conversations, and it has been such a nice journey that we've had today. Looking forward for many more such celebrities coming to us for this podcast that we are having with BVI Eye Conversations. See you again soon.